With a clear indication that there was a health help desk response team on location at the Jackson's International Airport, rigorous health measures are still being demanded from the National Department of Health to have proper checks and vital equipment in place to detect the virus at the airport checkpoints.
The only thing that we can get a case is from outside. So as I said earlier on, it's containment at the moment, screening, and what else we're doing at the airport. That's number one. Number two, all our virus settings, including the airports, all have been PP'd. All our staff and NUGINI and National Airports Corporation. That's the instructions that we gave them last week, and they're following it. We are working with them to make sure that we also support them with whatever requirements from us, including mask and all the other things that they require.
The media was able to observe a flight that had just come in from Honiara, Solomon Islands earlier this afternoon. After disembarking the flight, passengers were maneuvered towards the health staff stationed at the arrivals gate to fill out a health declaration form before they were allowed to pass through to immigration. It is understood that when and if there is a detection deemed positive upon arrival on an international flight, due process for further checks are set to take place that will see to the affected being taken to an isolation sick bay before being transported to the Port Moresby General Hospital for a more secluded isolation.
The thing that we need to understand for now is containment. We need to protect our ports of entry, which we are currently doing, and the most important thing also is we need to be prepared. So for us, in terms of the clinical part, in terms of the hospitals and ambulance, we are all set. We're going to ramp up as and when there are cases, but for the moment, we are under containment level. And we have all the health workers that we are planning to recruit on board. We have some already on board, we have some on standby, and the doctors also. So we are just making do with what we currently have in the system, and then when the situation changes, we're going to adapt accordingly.
Speaking to the media, Acting Health Secretary Dr. Paisen Dakulala says the department is doing everything within its means to give its utmost attention to the detection of the virus at the airport with the help of the ground staff and the airline companies.
Those who are part of the airlines, there's part who are the airport authorities, there's part who are part of the ports, there's the customs, and there's a whole lot of team that are coming on board in the whole response. There's the St. John's ambulance in the emergency. There's the clinicians at the Port Moresby General Hospital. So a whole core team, and I must say that it's quite a big team.
Making it also known in a conference earlier today that the department has submitted its proposal for the estimated cost of the vital equipment it needs to the National Executive Council pending approval, reassuring that this would be made available within the next couple of weeks.
We will hope to get in the thermal, screening, processes. We hope to get more of the PPE. That's the right attire to wear and then do the screen that way. And then when we get into the more complicated settings, then that's also going to have a lot of costings in terms of, in case those who come in who are sick, how do we manage them? That's a cost also. So we'll have to be looking at all of those. But it's depending on what we faced with. And so far, as you already know, and we keep on saying it, there are no cases at the moment declared or identified.
Annette Cora, National MTV News.